Congressman Michael Burgess here. It's September 9th, a little before 10 o'clock in the evening. We've just come off the House floor where the President has delivered his health care policy speech, the long-awaited health care policy speech, the speech that many people felt that he should have given many months ago. It's a little unclear in my mind just exactly what we were talking about in the House chamber earlier this evening. The President talked about his plan at several points. Of course, we have had 3 House plans and there are now 2 Senate plans out there, and it's unclear in my mind if the President has yet another plan that is going to be introduced. Obviously, the President's plan very closely followed the bills that have been debated on the House side the past several months. What is unclear at this point is how much more detail is the White House going to provide. The President made some fairly lofty predictions. He made some fairly lofty assessments. He made some rather bold predictions that this entire plan could be paid for simply by finding savings in Medicare and Medicaid, when the Congressional Budget Office earlier this summer said those savings are going to take years to materialize. So it's unclear exactly where the President was going to get the funding for this proposal. He did promise to not sign any bill that added 1 dime to the deficit. Well, that's encouraging, especially given how many things he promised during the course of that speech. I guess one of the bright spots for me was the President did acknowledge that liability reform was an important part of whatever happens in health care reform. He said he wanted to study the states that have made these reforms and have created some improvements. I would say there's no need to study. Come to Texas. We'll be glad to give you the plan. It's working well in our state with a cap on non-economic damages, and we'll be glad to school the President on what is apparently working well in the Lone Star State. A lot yet to be filled in on this speech tonight. Again, the President gave a good speech in many respects. It was well received by members of the House. Insurance companies and pharmaceutical companies took some pretty big hits. There will be some significant taxes on those 2 entities, according to the President. But again, the details of this are far from fleshed out, and probably tonight there are many more questions, new questions that have been raised than any questions that were answered.